Hey there, Dr. Courtney King here, Golden Road Medicine, and today I wanted to show everyone how to do an enema properly. I know that's not what everyone wants to do with their spare time, but there are many health benefits. There are many kinds of enemas that you can do. The one that I was going to talk to you today is about coffee enemas. They are very detoxifying. There are some alternative cancer treatments used with coffee enemas. That treatment's been around since the 30s. And people do them for overall health and wellness. And I wanted to show you today with my volunteer baby how exactly you do an enema so that they maybe won't be so scary if you decide that they are right for you. So this is an enema bucket. And they also come, there's plastic ones. I don't like plastic because then you're putting other toxins. They're BPA-free ones. This is a stainless steel bucket, and they all come with tubing. And what you first want to do is you get the end of the tube and you put it on the bucket. You can also use hot water bottles, like the old school hot water bottles. Those also have a little place where you can clamp a tube if you get them for enemas. And then there are many different nozzles. I'm not sure who uses this one. This one looks more realistic. I like these kind of flexible tips, not painful. They really are less invasive than you would think. So we're going to use one of those today. And so the best way to start if you've never done an enema is just a water enema or a saltwater enema. And you don't need much sea salt. You could put about 2 teaspoons into a liter of filtered water. You want to make sure you use clean filtered water. Again, whatever you put into your rectum through an enema is going pretty much straight to your liver because your portal vein is right there in that area, takes things straight to the liver, which is why it's so great for detoxification, but you also want to make sure not to introduce any toxins. So, just makes it much harder on your liver. So, if you're using coffee, you're going to have gone ahead and boiled the coffee into the filtered water. We're just going to use water for today. Baby doesn't need much detoxifying. Let's say baby's constipated. It's great for constipation. It's great for hemorrhoids. So now I want to show you how to prime it. I'm going to usually you do this over the sink because a little will come out. So here's my tip that I've placed carefully on this end. And this is the clamp. Very much the most important part of the process because you want to be able to clamp off the fluid whenever you want to, especially in the middle of doing the enema and especially at the beginning. So you clamp it really tightly. You do not want things to flow. The enema bucket will be up at elevation. You can hang it on a towel rack. You can hang it on your shower curtain. You can hold it in your hand, but I need 2 hands. So you want to make sure to get the air out. So the water is now to this point, and you let a little bit out into the bucket or into the sink, just to make sure you have the water to here so that you don't introduce too much air. Now, baby's on a towel here. Usually this is done in the bathtub if you're just starting out. I put about 6 towels down, get it really comfortable, kind of make a little pillow area. And then when you're first putting it in, you kind of put your knees to your chest, like so, and gently insert the rectal probe. Baby's small, so not the same for this particular circumstance, but about 2 to 3 inches into your rectum. You definitely want to make sure, sometimes there's little holes on the tip, and you want to make sure those are fully in there. So, about that far in. If it's uncomfortable, pull a little bit out, but if you don't have it all the way in, it'll leak, and that is not what you're going for. Although you're in the bathtub with towels, so it's cool. This little part here, some have it and some don't. It's a back valve, so it makes sure that fluid only goes one way so that any contents that went this way aren't going to go back into the tube. Helps it stay clean. It's another very important part of the enema is cleaning all of this afterwards. So after you've been, stuck it in a little bit of a ways, you get the clamp in your hand and you unclamp it slowly at a time, let a little bit go through, clamp it off. If you start to feel any cramping, clamp it off for a minute, do a little abdominal massage. You're going to want to go counterclockwise. Another thing to do is you can lay on your right side, liver down. That can be more comfortable. Once you've gotten, 3 or 4 cups, about a liter into your body, into your colon. So you keep, letting it out, go, hold it. You're going to have some peristalsis. You're going to feel like you can't hold it. Try to hold it. If you're new to enemas, if you can even hold it for 5 minutes, that would be fantastic. The goal is about 15 minutes. That way, whatever nutrient you're putting in the enema has time to get into your body, get all the way through your colon as much as it can. If you're using coffee, I just wanted to show you an example. This is coffee specifically made for coffee enemas. You'll notice it's a very light color. It does not look like coffee at all. This is just ground. And they roast it closer to 419 degrees. I don't know why that degrees, but it produces more caffeine. Lighter roasts have more caffeine and palmitic acid, which is, in the two of those things, they dilate your blood vessels. So it helps to get the liver to get toxins out through your bile more quickly and efficiently. So the bile ducts are also dilated so that more toxins can flow faster. It also increases some very important enzyme families that are very crucial to detoxification, as well as the coffee enemas really boost one of your master antioxidants that help with the whole process and really get things running smoothly and add to overall health. So other kinds of enemas that people do, I've heard of people who do ones with wheatgrass juice. I know that I've done some with probiotics before. You can open your probiotic capsules into the water. You can use aloe, I know, is one that's used in Ayurvedic medicine. You can boil seaweed into water and use that for kind of a gelatinous, same idea. And they treat different things. There are ones that alkalize your colon. There are ones that, help with constipation and breaking things up and getting the toxins out. So they all help you become more regular. And when you're just starting out, make sure the water is warm. You want it to be room temperature. So it'll feel hot to the touch when you put it in. So if you've boiled water, let it cool. Or if you if you've boiled coffee, usually use about 2 tablespoons for 3 to 4 cups of water. You could boil it in less water and then add some water at the end if you want to get it going quickly after you brew the coffee. You can use a French press. You can use an automatic drip coffee. You can boil it and strain it. That's up to you. The main thing you want to make sure is to stay comfortable. You can move from side to side. You can do a little bridge pose, yoga positions, whatever feels comfortable to you and helps you try to retain it for the 15 minutes. It takes time and practice and patience. So if you don't get it the first time, keep trying. The benefits are real. So why don't I take you to my bathroom really quickly? I use the bathroom in my office because no one's going to walk in on me there, and I make it very comfortable. So come with me. Okay, so welcome to my bathroom. And here we've got the setup right here. I took 2 curtain holders from my shower rack and hang it on the towel rack here. And the tube is very long, plenty of room. I could have, you can see where I took them up. You can also hang it from the bar if you have a long enough tube, depends. There's baby already comfy in the tub, our hand on the clamp and ready to go. Fluid would be flowing if the clamp was open. And the last thing I forgot to talk about that is super important is you'll need to use a little bit of coconut oil for a lubricant on the tip of the rectal tip there. And then you just sit there comfortable as you can, knees up at first, lay on your right side for a little while, lay on your left side for a little while. You can do bridge pose, whatever seems comfortable and helps you retain the fluid, and massage your abdomen, turn on some nice music, some candles, and enjoy.